wage enhancement, those recruitment being taken are going to be affected because of that wage enhancement.
The budget for drugs also was increased, although it is still not enough. It was increased. I think that is from last year, last financial year, by 700.
And they bring every month now.
Every 2 months after 2 months.
Yeah, I mean, Benna, like make my visit to this hospital monthly official, not as an MP, but as a Minister of State, where I officially visit the hospital. Yes. Once in a while, if I get one of the health ministers or friends or donors, I could come with them. Yes, during those periodic visits. The other doctor who we had, who was going to be charged that time for taking money from a mother, is he still working here or?
RDC has told you we get challenges with the interns. It was actually an intern.
So did you finally graduate?
He was signed off. Yeah.
What is doing better wherever he went? True. And I was told even recently you had similar disciplinary issues.
We have had
the
challenges
police,
like...
the police said even recently there were some others of similar nature.
Like we have told you, we have had challenges and the administration is doing what it can, and like last time I explained to you the measures. And of course once in a while we get people from the IGG, we get people taking complaints to police. So it's like we do everything. There are internal mechanisms, then there are external mechanisms which people face. But overall is we want to improve the welfare of the workers so that people do not have excuses. People do not have excuses. Yeah. Because you may get somebody in a problem and then somebody gives you an excuse. And then he says, look at my condition. So we want to remove the... We know the law is the law.
Government recently increased salaries for medical workers.
For us, but for the interns it's going lower.
And the president even promised.
For the interns...
I'm talking about medical workers, not
yes. Medical workers, we are having actually an increment or whatever. And yes, there has been...
And I need the media to capture this very well. Yes.
There has been positive and overall people do what? In the government sector. I'm not sure, but I'm going to say it. Maybe getting a little bit better than those in the private what? Sector. One of the problems we have, like
Dr. Anina, the people in the government sector could be getting a little better
than those that is the truth, the reality.
And this is a senior.
That is a fact we
in
have
fact, even as a private facility,
we have to accept.
So
and then we don't want
excuse
people to have what? Excuse. We do not want people to have the excuse. That's why we are even increasing on the staffing to make sure that all the shifts are adequately what? Covered. And if we increase our staffing, then there will be no excuse for anybody. For example, to jump his shift and I said I worked the last 2 nights alone. Yeah, so that's what we are actually working on.
In fact, we found out, as we are putting many cameras in our facility.
Please, we need those cameras.
And we also
I hope they are working.
We are also recruiting new security.
Do you have
companies.
Do you have a control room with control officers watching them?
We have a control room but the
You
officers
don't,
are multitasks. These are our
multitasking.
ICT doing all works of electronic medication. However, I was also wanted to inform that we also found out some masqueraders, people pretending to be doctors,
We have also,
pretending to
yes.
be nurses. So with those strength of cameras and the security team on the ground, we hope to minimize those people.
I
So at
think,
times, someone pretend to be a recruited health workers whom there is not, and they end up stealing our patients.
in fact, maternity has got about 3 such people, and the cases were even there.
Have they sent them out from the hospital? Have you
They,
mentioned
yes, but again, like they told you, one of the things again we are working on is making sure by the Ministry of Health, every staff is uniformed and has a name tag. And that is one
hard
thing.
about a uniform? If schools in villages have
No,
uniforms.
it's now easy to identify because if you walk around the hospital with your name, it is easier
That's why
even
I'm saying
for.
what is so hard about every medical worker having their coat with their
We have them, but these
Yeah.
people are very wise. They can even put on fake
Mm.
names.
Mm.
But at least we are
But
trying to
we-
spread
They
them.
don't have the hospital inspector who's like on duty full time.
We do, but
That's how we've got them and even arrested
Yeah.
some.
Okay.
One was actually arrested even by attendants because he was asking money and saying, I'm going to give you money for drugs. So the attendants had seen him and they reported to a worker, and the worker failed to get him. So the next day when he came back, that it is the attendants who actually helped him with what? Apprehension. But again, those are things which if we worked on the infrastructure.
They have a control room that is functioning. If I was there now, the cameras are working.
yes, they will.
How long do they keep footage? Some cameras keep 45 days, others a year, others 16. Those ones keep for how long? Yes, they are.
Normally it is 4 weeks, but I think it is the ICT who can. The backup is usually 4 weeks. Depending on
How
that,
many hospital inspectors do you have?
we have night superintendents, what are called night superintendents. So the night superintendent goes around all wards.
That's
But
not a
that
security, but inspector.
Security, we have
No,
the.
no, no. Before about security, the inspectors now. How many do you have? Hospital inspectors?
Those are the superintendents.
Those are the
in our towns.
superintendents
That is
in
only
our
talking about
towns.
night.
During the day, there is a day and night. Usually the problems at night. You are always going to get problems at night because most of the staff has retired. There is lower staff
At night you have how
presence.
many?
Eh?
At night you have how many?
We have 2. That one goes all around. Then there is also security, but again our security
At
personnel.
daytime you have how many?
Daytime is still 2.
Do they have to be medics? Are they doctors? Are they nurses? What
They
are
are
they?
mainly senior nurses.
Mm.
Yeah.
I think we shall need more. Shall
Yeah,
need more.
nurses.
We need at least 3 in the day and 4 in the night. Yes.
Because during the day usually the head of nursing is around and her assistant is also around. Then even the head of departments most of the day are around, the in charge of wards, the administrators are also around. It is usually during the night when we get challenges.
We should be in the day. 4 should be in the night. And lastly, you were talking about the security. The hospital is guided by what security?
Currently, they are recruited like us from government people. But starting next month, we are getting a company, alternate security.
Who is there? Who has been guiding? Police, UPD?
Staff. under the guards category, support services. Yes.
So they were not armed.
Yeah. But at least starting next month, we have, with that raise of the nanny wage
And
budget,
you know at how many guards?
we are looking at up to 10 day and night, 5. Then they are beefed up with these other local ones.
5 at night, 5.
5 then, because we want like 2 people at the gate, because then that the gate is compromised.
You need security at a regional. Why isn't?
It has always been, those are the problems of guarding, because at one time we even tried to engage the local defense
And the
force.
police.
Yeah,
In
and
fact, police
police.
was here, but
Yeah.
later.
We
The
had a
police-
police post here, it was taken away, and it used to boost our security.
Why was it
I'm
taken
not sure of the reason, but
Oh, it's
it
the
was
issue of
taken
Our
away.
head of security.
The issue of sub-county
Mm.
police policy,
Mm.
realizing the deployment,
Mm.
and now maybe following, if you talk to the Inspector General of Police as a special case here, you can order the reinstatement, but as a policy, and the new structure of police now, those small things have been
And security is very important here
Very
in terms of the equipment we have, the human resource we have,
That's how people are stealing
the
medicine.
attendance we have, even the babies have been going.
How
The
many babies have
patients,
been stolen?
we have, though I think we had an incident of about 2. Luckily enough, the babies were recovered because it was interrelated here. That's how, but if it had been probably somebody out of the blue not related to
A
this
certain
people.
woman came crying at our rally
Mm.
that her baby was exchanged when Honorable Balam was here and
Not
for
to
like expose the
the
corrupt.
best of our knowledge.
She came crying at our rally. I think she's from Kalangala, but she gave birth here. But I think the child is now a bit old, like about 5 years or 8.
We are not aware of that case,
Maybe
at
it was
least
in one of the health
officially,
centers, probably
maybe
it
the
was in
health
the
center.
Okay. So, Bena, kindly get all our contacts. Of course, I have Dr. Senyo's number. Get the rest of the contacts. And I think going forward, we shall keep having that.
Yeah, it's good always honorable to have that interaction. We also welcome improper to whatever visits. We do actually welcome them.
Yes, please, but they should
long-
welcome the spot
yes,
checks.
the spot
It is
checks,
you doing your work.
we welcome them.
Instead of you
As
shouting
long
to
as
the
they are
doctors, for me,
amiable.
come and-
Yes, as long as they are amiable.
And
we
welcome the
interact
nurses who
well.
are online. While the patients are crying, I go to them actually. Yes. So some you find them online, others are conversing.
Mm.
But if they know that there's always sport checks, they will always they will also put themselves in the sport. Yes, so Bena, please give me 250,000